Both Kansas and Missouri are seeing a jump in cases since last week. Kansas saw 372 new cases since Friday. In Missouri, the state continues the trend, adding 206 new cases. In Kansas, the average number of tests coming back positive is up to 4.1%. In Missouri, it's 3.3%. The World Health Organization wants that number at 10% or below. In Independence, a long-term care facility is seeing its second outbreak in less than a week. As of today, there are 39 cases of COVID-19 at Independence Manor. The first case was reported last week. The other 38 cases came back positive over the weekend. 65 people live at that facility and there are 65 staff members. The City of Independence now has outbreaks in 3 long-term care and rehab facilities. And we have an update now on COVID-19 testing at the John Knox Village Care Center. 9 employees have now tested positive at the Assisted Living Center in Lee Summit. So far, all residents have tested negative. More results are expected by the end of the week. John Knox Village does not have any additional cases outside of the Village Care Center. Tomorrow, the state of Missouri will fully reopen, and that means there will be no statewide order in place. But it's important to note local leaders can still set their own restrictions, so you'll likely see restrictions in counties, cities, and towns in our area. For example, Kansas City, Missouri is still under an emergency order until July 5th. As far as customers go, all businesses in the city are limited to half their capacities. There are no limits on the size of social gatherings, though. Table separation at restaurants must be 10 feet plus 6 feet between parties from the backs of the chairs. The state of Texas continues to see a record number of hospitalizations. On Sunday, Texas reported more than 2,200 people were hospitalized. Even with the spike, the state has continued to move forward with its reopening plan, with restaurants being allowed to increase capacity to 75%, and almost all businesses are allowed to operate with 50% capacity. Now, locally, we have not seen a surge in COVID-19 hospitalizations, but with concern over a possible second wave of the virus, hospitals have to be prepared.
All the patients in this room, all the feet that you see, they all have COVID.
Early on in the pandemic, we saw East Coast hospitals overwhelmed with severe cases of COVID-19. Hospitals here prepared for that scenario, but we have not experienced it.
By having that lead time, we were able to make sure that we had our social distancing in place. We had a lot of our community actions of shutting down the community, really, and our shelter-in-place orders were already in place before the virus really came rampant in the metropolitan area.
Dr. Larson is part of St. Luke's Health System's COVID-19 response team. Out of its 18 hospitals, there are currently 17 inpatient cases. The number peaked in April with 35. While there's concern about a second wave of the virus, he says hospitals are ready. Necessary equipment is in place. There's more testing now to better track any potential spike in cases, and they know the level of PPE needed.
I remember at the beginning of this, I had to say personal protective equipment. Nobody knew what PPE was. Now that's a common phrase. It'll be added to Webster's this year, I'm sure.
His greatest concern is reopening too fast without taking precautions because COVID-19 is still out there.
The more you see people starting to pile back in and loosen up on some of these social distancing measures that have been in place, I think it is a little anxiety provoking because we don't want to see a massive outbreak.
Doctors say testing will be as important as ever when flu season hits because initially influenza illnesses look a lot like COVID-19. Dr. Larson's already encouraging everyone to get a flu shot when it becomes available. The American Red Cross is now testing all blood donations for COVID-19 antibodies. The results will be available within 7 to 10 days, and it will let donors know if they've been exposed to the virus and produced the antibodies. The Red Cross says it is not a diagnostic test. As the antibody test is still developing, it's not a confirmation of infection or immunity.